Resident doctors will walk out for 5 days from Wednesday morning after rejecting a new government offer. The BMA says that the strike is still entirely avoidable and it is willing to work to find a solution. Dr. Tony O'Sullivan joins us now on LBC News. He's co-chair of Keep Our NHS Public and a retired consultant paediatrician. Good evening to you, Dr. O'Sullivan. What does the message need to be to patients now, who are no doubt listening to all of this, those warnings from the health secretary and concerned that if they or a loved one are planning to be or may end up in hospital next week, what should the message to them be?
The situation is that the NHS needs to have enough staff who are well supported to give of their best for the public, to look after the patients and to keep resident doctors so that they will stay in the NHS and become trained consultants and GPs. Regret the fact that a strike is necessary. The BMA have been in dispute over trying to get pay recovery since this government has come into power. And it's very regretful for the patients indeed that they will have operations cancelled if that is the case. The NHS is still an excellent service. We must look at the context in which this strike is happening. And before the strike in November and December, and without any strike conflict, the NHS is a system under very serious stress. The Royal College of Emergency Medicine have studied the last 2 years, and over 16,000 patients have died avoidable deaths because of delayed urgent treatment in A&E and getting to a hospital bed. And that's 46 people every single day. There's 95% bed occupancy of the NHS at the moment, over that. And all the year round, even not in winter, that the bed occupancy is over 90%, and that's actually dangerous. The recommendation is 85%. So the 1 in 5 patients already going to A&E and needing to be admitted to hospital are experiencing corridor care. And that's really tragic, and it can be lethal, but certainly damaging tens of thousands of patients.
Are these strikes, though, necessary in your view? We did have an offer from the government. They've been very clear they can't afford the pay demands, but it would have gone some way to improving conditions and training places. Was that offer just not good enough?
For me, the offer fell down on 3 counts. First of all, West Streeting has offered no pathway beyond this year's pay award and next year's, which is actually well below inflation at the moment. So that was another pay cut. The second thing was there's not enough training posts. They're employed by trust because they need doctors, but they're not on training programs. He transferred up to 4,000 of those to training posts. And that is a positive step in my view, but he hasn't created any extra jobs. So it's really the same number of doctors, and there aren't enough of them, just being able to get training posts, but not being able to expand medical workforce. There's also no employment guarantee for doctors who are stuck in that bottleneck where they've finished their medical degree, they finished their 2 years foundation course, and then they're trying to get onto training posts to become what the NHS needs: GPs, oncologists, anaesthetists, radiologists, capable of maintaining the NHS with consultant and multidisciplinary teamwork. So there's no guarantee for doctors who are stuck in that bottleneck that they won't lose their jobs. So those are some of the things that I feel the offer has fallen down on. They decided to take that action now when the government isn't listening to them. The fact that it's winter is another issue for me, that this country is extraordinary, that successive governments have allowed this winter crisis panic every year without building in the planning in terms of resources that allows the NHS to be flexible and expand to meet the need of a winter epidemic, for example, in other similar countries like France and Germany. They know that every single winter more people get sick and they need more resources. So in Germany, they've got 50% more beds, 50% more doctors, something similar to the number of nurses, and they have the flexibility built in so that they're not running at over 95% bed occupancy. They have the flexible planning to have coped with untoward circumstances. And I think successive governments, not just this one, failed to meet the needs of a system through the ups and downs of intensity of need.
OK, Dr. O'Sullivan, that is Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public and a retired consultant paediatrician.